planning, implementation, evaluation of disease control in a community. It's a big name, it's a big title. So let's make it simple. Basically, it deals with how you plan for something in your setting as a medical officer or as something. So let's go a bit here. So okay. So what is planning? Planning is basically decision making, anticipated decision, deciding when to do, what to do, and with available resources. And it's important for health promotion and disease control. So without planning, you cannot control any disease. Without planning, in fact, you cannot do anything else in life. But particularly in this, planning is important. Anticipated decision. So here again, best use of scarce resources. You don't have 120 medical officers, you have a few medical officers, you don't have that many resources. Avoid duplication and wasteful expenditure, and helps for problem prioritization, develops a course of action. Every sentence is important. If you can't understand the English, I'll just explain to you in Bengali. Best sources of scarce resources. Beshi jinish nei, amader ota diye kaj korte hobe. Avoid duplication, wasteful expenditure. Okay. Then problem prioritization. Kon jinish beshi important ache. And develop a course of action. So here, this is a cycle. I'm not sure whether you can see it properly because of the color thing. First one is, step 1 is analysis. Step 2 is identify the problems and prioritize. Step 3 is setting the objectives. Step 4 is develop the plan of work. Step 5 is implementation. And step 6 is evaluation. So this is basically the things which you have to do. First is analysis. Then you identify the problems and prioritize. Third is setting objectives. 4 is developing plan of work. 5 is implementation, and 6 is evaluation. So a situation analysis. First is you collect the information. From where will you collect the information? From the field, from the community, from this and socio-economic data and also demographic data. That is called situational analysis. You are collecting the information locally. Assessment is you find out what is the problem, magnitude and size of the problem, severity of the problem. Suppose there is one person in a village, he's got diarrhea. Is it a problem? Is it a problem? One person has diarrhea in a village. But it is a problem if there are 15 people, 20 people with diarrhea in the village, that is a problem. So, what is the problem? Magnitude of the problem, severity of the problem. These are things which are to be noted. So then you have, how will you get this information? Primary data. It is you do a survey and you do a interview of the people. Secondary data is existing records and data collected from various sources. So these are the ways in which you can get the basic data. The first is you need data to proceed. Where will you get the data? Go to the field, do a survey, go to the field, do an interview. Then secondary data is existing records that are there and data collected for various purposes. So what do we have at the ends of need assessment? We have a lot of various problems. Some place there is no water, some place some disease is there, some place something else is there. So we cannot handle all those things at the same time. So we have to make a list of that, then you have to prioritize for it. So again, magnitude of the problem, how big is the problem? Severity of the problem, does it cause fatalities? Is there a consequence? Does it cause disability? Okay. So if it's a small, I'll give you an example, if it's a small respiratory tract infection, is it a problem? Yes or no? No. But if there are 50 people today with respiratory tract infection, what do you think of? Maybe corona. Corona is coming back, according to newspapers, it's coming back. So that is how you see. And if it's corona, there can be fatalities. So then the third thing is feasibility in terms of time and resources. How much money, how much people, how much manpower you have. And government concern, whether it's priority policy or not. Government may, because it's COVID, yes, they have the money, they'll do it. But if something else, malaria may not be that important, dengue may not be that important. I'm just giving examples, okay. Now, this is a common saying about planning. If you do not know where you're going, then any road will do. If you do not know where you're going, then any road will do. रास्ता जाना ना तो जेखोनो रास्ता के लिए तो एक ही अवस्था है for it. If you do not know where you're going, how will you know you have arrived? If you do not know where you're going, how will you know you have arrived? You don't know. So that's again a major thing in planning. Next. So once the problems have been prioritized, the next step is to be set an objective. It is impossible to evaluate something without a clearly stated objective. What is the objective? So what do we want to achieve? Where? Who is the target group? When do we want to achieve? And the extent of achievement. These are important. You can't use like a specific objective. Now, that objective changes from time to time. Okay. So, this is called SMART objective. S-M-A-R-T. Specific. Simple, which relates to a specific event. Measurable. Has an indicator which is measurable. Say, for example, no COVID cases. A small example. Achievable, considering resources at hand. How much money, how much manpower, how much other resources do you have? Then realistic, relevant. It can reduce or solve a problem relevant to community. And the last one is time bound. It can be done within a specific time period. This is called SMART objective. Each one is important. S for specific, simple. M for measurable. A for achievable. R for realistic or relevant. And T is time bound. SMART objective. Okay. Now then you have a plan of work. It's a detailed schedule of activities to be done in a given period of time. It should specify the role of different persons involved, at the time in which should be involved, and what methods are to be used. Each person should be given an allotted time and what is to be done in that particular time, each role. So in other words, the work plan should give an idea when it should start, when it should be completed, who does it, who is responsible for doing it, and what materials and resources are needed. Simple. Like you want to complete a second MBBS exam. What are the subjects for a second MBBS exam? You have your pathology, you have pharmacology, you have microbiology. So you have so many marks for this. So how much time will you give? 2 hours for microbiology, 3 hours for pharmacology, 3 hours for pathology, whatever it is, and you are doing it. That's also your plan, right? Implementation of program. Implementation is carrying out the plan or putting the plan into action. It is translating the goals, objective and methods into a community-based health education program. So this is implementation of the program. And monitoring. Monitoring is you are actually seeing how the plan is being implemented. It is systemic collection and analysis of information in the progress. It helps to keep the work on track. Enables the planners to detect any kind of problems as early as possible and to give relevant solutions to the problems detected. So, you are monitoring the activity. Suppose you are making a nursing home after 10 years, for example. You are seeing how much the building is going, whether it is been done properly. So, you are monitoring the activity. You suddenly come back from UK after 10 years and you find that the building is made but it has got a lot of faults. That does not work. So, you have to keep monitoring it. Similarly, monitoring is systemic collection and analysis of information on the project progress. It helps to keep the work on track. Enables the planners to detect any kind of problems. Maybe your contractor has made some mistake. You can tell him to change the material. Maybe you can change the contractor also, and to give relevant solutions to problems detected. Okay. Evaluation. Now, evaluation is a process of assessing whether the health education interventions are attaining the goals and objectives which are predetermined. How effective is it, and how is the efficiency? Okay. So this is done by evaluation, which is usually done at the end of the program. Monitoring is done during the program. Evaluation is done after the program is over. So this is again two definitions about plan. A plan is a decision about a course of action. And planning is bringing the future, and that is one definition by somebody called E.C. Banfield. Second one is planning is bringing the future into the present so that you can do something about it now. Okay. So what is planning again? Planning is a systematic approach of defining a problem, setting priorities, developing specific goals and objectives, and determining alternative strategies and methods of implementation. And basically, a plan is a blueprint for taking action. It is a decision about a group of action. It is a product of planning process. So this is a plan. Often we suddenly jump, we got a plan, we'll do it. So, but planning is, there's a certain processes in plan. You cannot do the plan all of a sudden. So, the need for health planning is to strike a balance between resources and needs, avoid wastage of resources, to reach a goal in the smartest way, and to improve the health services. This is the way you actually work on a plan. So, types of planning. So, normally, this internal planning is done. Internal planning is done by people familiar with the organization. The people in the health system, they do the internal planning. Individuals who belong to the same organization and recruited exclusively to formulate plans for the system. The advantage is he has a fair idea about the system. Disadvantage may carry some bias. Like I may think that so-and-so is a bad worker, this person is a good worker. So there may be bias. So for that we have what is called external planning. Next one. It is done by personal recruit from outside. They work for a short period of time. They give some recommendations. They are supposed to be unbiased. They don't know the system. They come up with some ideas which may or may not work. And they give new plans, size changes to solve a problem. Advantage is that it's a fresher look, less bias, greater sense of objectivity. Disadvantage requires time to understand symptoms. I'll give an example of this. When I was posted in Bihar in polio, the polio project for WHO, we had a visitor from UK, a lady. So those days it was the ANMs or the ANFs, auxiliary nurse midwives, who used to give polio vaccine. So I sent her to my area, and in the evening she gives me a feedback. She tells me, Dr. Menon, I want to give you some feedback. I said, what? She said, told me ANM should be removed from the program. So I was surprised. ANM should be removed from the program. So who's going to work? She said, sir, today I went to one particular place and the work stopped for half an hour. I said, why? She said, the ANM went to a house where the lady was due to deliver, and the ANM conducted delivery. As a result, for 2 hours the work, there was pulse polio work, was not done. The work had to stop. So then I said, so what do you suggest? So I suggest that the ANM should only do health-related activities, not give pulse polio, do pulse polio. And I said, but this also had. Then she's telling me, do you expect the baby to wait for your pulse polio activity to get over? So her important priority should be given to deliver the baby. Let the pulse polio activity differ a bit. So in the end, she gives a recommendation. After that, the workers have become Anganwadi workers and the Asha workers are doing it. So this was a recommendation at that time, which I literally laughed. Who's going to do it? If the Anganwadi worker will not do it, who's going to do it? But she gave a recommendation to our office in Patna. They sent it to Delhi. Finally, we got replaced by Anganwadi workers and Asha workers. They're giving it. ANMs, they are doing the other health activities. Next. So planning includes plan formulation, execution, implementation, evaluation and assessment for it. So situation analysis, same thing. Situation analysis is a planning, determining priorities, developing aims and objectives, resource assessment, write out the plan, implementation, monitoring, evaluation and assessment. Okay. Situation analysis, again we talked about how you're going to do it. Collection, assessment, interpretation of data in such a way as to provide a clear picture of the health situation. Primary data is through interviews, questionnaires, examination. Secondary data is through various records or database. Then again, determine the priorities. How many people are affected with it? Is it severe? Are they dying because of it? Is there disabilities? Then whether lack of services are there, High risk groups include school children, elderly, physically and mentally handicapped. All these are your priorities. So which priority are you going to take? Are you going to take the elderly people? Are you going to take children? Are you going to take the school going kids? Are you going to take the physically and mentally handicapped persons? These are all the important things which are there in the priorities. Then determinants of goals and objectives. It guides efforts. It prevents haphazard activity. Haphazard activity means you moving here, moving there without any plan. Okay. Like for example, I'll give you another example. There were floods in Kerala a few years back, severe floods, and I was in Kerala at that time. So our college, the college where I was working, we decided to go for a flood relief department. It's a private, that is also a private college. We went to the primary health center, but most of them, first we went to primary health center without any equipment. We didn't know. We didn't even take a BP apparatus or test, very few. That was the first mistake. Second mistake was, we went to the camp. Most of them had some itching, but we had only 1 or 2 ointments. Every patient in the camp, there were about 200 odd people, almost everybody wanted some ointment for the itching. Itching because they were walking in water, stagnant water. But we had only 1 or 2 creams. So that was a big mistake. We didn't plan for it. Uneconomical use of funds, time and resources. Okay. And so these are the goals and aims and objectives and measure work for it. Assessment of resources, manpower, money, materials, knowledge, skills, techniques. So for anything you need manpower, you need money, you need materials, you need knowledge, you need skills, you need techniques. These are all very important. So write up of the formulated plan. Each stage of the plan is defined and costed. Time needed to implement is noted. And it should have a guidance for each person. Like what should the medical officer do? What could the medical officer in charge do? What should the nurse do? What should the pharmacist do? What should somebody else do? So this should also contain a built-in system of evaluation. Next. The planning and implementation, definition of roles and tasks, selection, training and motivation of the supervision of the manpower involved. So you're training the person. You can't just put somebody into the battlefield without he's trained. So selection, training, motivation and supervision of manpower and organization and communication. That person should be able to give feedback to you. You should be able to give feedback also for it. And monitoring. Monitoring is a continuous process of observing, recording, reporting on activities of the project. This is continuous, not at the end of the project, during the project. And then there's another one, evaluation is to assess the achievements of the stated objectives of the program. After the achievements, whether it is evaluated to see whether it's adequate, efficient and is acceptable by all parties. Okay, this is evaluation. Monitoring is a continuous process. Evaluation is at the end of the process. You are seeing how it is. You are making a building, you are making a nursing home. While the nursing home is building up, you're monitoring the activity, whether the contractor has cheated you or something like that. At the end of it, once it's ended, you are seeing how good the nursing home is, whether it has got proper, does it satisfy the criteria of NABH or does it patient friendly, etc., etc. That is evaluation. Evaluation is essential for decision making or future plans, and it's also called systematic investigation of the merit, worth or significance of an objective or program. Now here there's one thing, suppose you spend so much money on some event and this doesn't yield the necessary, so for example, just an example, you have a hospital in Sonajari Hat. Do you think people will come there? What do you think? Every day there is a crowd of about maybe 2,000 people in Sonajari Hat. So you think hospital will work there? Yes or no? Keep on having. Sonajari Hat hospital cholve. She's saying cholve. Because it's a tourist spot, but people don't have any hospital. Maybe we don't know. So that is the thing. What is the future plan? How can a hospital call log nahi? So then they'll probably have to shift the hospital. So, essential for decision making on future plan, and maybe define a systematic investigation of merit, worth or significance of an object or program. It's an applied research, it involves value judgments, and it cannot be applied to all things. I just give an example, but it's not applicable everywhere. So, picture Porata. Monitoring is Porata. Scrivens, this is one classification 67. We have two evaluations. One is formative evaluation and summative. Formative means internal evaluation occurs during the implementation program and it aims at the program development. Summative is at the end of the program. It's mainly for decision makers and actually judges the worth of the program. You have spent so much money, but the effect is not there. It's of no use. So you have to. How beneficial is it? Actually, summative evaluation is more beneficial because at the end of the program, this is done for it. Steps in evaluation. Now, this is important. What are you going to evaluate? Structural evaluation. You are seeing the program settings. Program evaluation. What is the method that is being used? How are you actually evaluating it? There must be some method. Suppose you say that this method is good or that method is good. How are you evaluating it? Like say, for example, you are giving mosquito nets to everybody. There should be a decrease in malaria cases or dengue cases. But if there is no decrease, that means something is wrong. So, it refers to techniques or methods employed. Outcome evaluation, impact of the program. Then again, steps of establishment of standard criteria, structural criteria, physical facilities and equipment, process criteria is functioning of planning, and outcome is end result. Again, structural criteria, you have a hospital or a primary health center. Process criteria, functioning, whether it's functioning or not, medical officers on leave, pharmacist is running the show, the A&M is not there. So, what is the end result? That we have establishment standard criteria. Planning the methodology, certain standards and criteria must be included in the planning stage, which needs to be evaluated. You are evaluating something, you should know what you are evaluating. Okay. Like, for example, I want to evaluate the standard of MBBS students of second year. You are a second year, right? So, how will I evaluate it? Obviously, the exams is a big thing. Your attendance is another factor. Attendance is poor, but exams are good, very good. Your exams, your passing rate is quite good. But then if your passing rate is bad, I will evaluate you differently. So, criteria, certain standards and criteria must be included in the planning stage, which needs to be evaluated. So, you cannot say 150 students, all are good, all are bad. The criteria which the university says is, how many of you have passed? Okay. Another criteria which people say is, well, they may be having other criteria. What is the attendance rate? What is the attendance rate? What is your faculty like? Etc. Okay. For it. And steps in evaluation, again, gathering information regarding political, cultural, economic, environmental and administrative factors, analysis of results, taking action, that is shifting priorities, modify objectives, modify the plan, and re-evaluation. Evaluation is an ongoing process and health activity should be more relevant, effective and efficient. Okay. So, we keep talking about health, and health is one aspect in which new things are coming every day. 6 years back, we never knew something about corona. But corona came and thousands of people, maybe lakhs of people have been affected. Many have died. Okay. So, that is something 6 years back we never heard. C was for cancer or for cardiac disease. Now, we have C for corona. So, health is something which is always keep changing its thing. So, now this I will give to, I am not boasting my own trumpet, but this is a real say. I was working in WHO, we had a place called Parkour, which is 2 hours from here. There had one case of polio in 2010. There were also 2 cases adjoining Measurable and Murshidabad till June. And there was a single surveillance medical officer of WHO, unfortunately, that was me. So, polio was a big emergency that time, and I was the only medical officer over there. So, we had one polio case, 2 cases in Measurable and Murshidabad. The Measurable case was in Murari, and Murshidabad case was in Dhulian. Okay, so I was all alone. So, how did the WHO respond? Outside. Then this is again this was the end result. What happened? All of them belong to the same community. Again, I was the only person on duty, but WHO had funds in plenty. Okay, funds was not a problem for it. So, what are the possible solutions? You have multiple rounds, put more manpower, put more vaccines, and assess resources. So, what did the WHO do actually? I was the only guy on duty there in Pakur. Okay, as you can see over here, 2010, quite some years back, for a time. I'm alone with another staff. Next, for a time. Next, alone in the field. Next, suddenly my friends come. This was my old driver right side, my colleague from Hazaribagh. He had come to help. Okay, so WHO sent a lot of people. Next, there's not even space to sit or stand in the office. We had 9 of us, 10 of us from all over in this place. Okay. Next, and these were the people from Delhi who had come. My boss is in Delhi, to my right side. To gentleman with the beard was my immediate boss. And next, there's also a person from Zimbabwe, international people also who had come to Pakur. This lady from Zimbabwe, she's examining the immunization card. Okay. So, next. So, this is what happened this is what WHO did. But the result was fantastic. Pakur reported 2 cases out of 42 in India, including the last case of wild polio type 3 virus, which was detected in Pakur. But after that, there was only 1 case. It was from Howrah, which was the last polio case in India. So, what did we do? Assess manpower resources. I was the only person. Put more manpower. They put in all 10 SMOs. More vaccines, more frequent rounds. The result was we would manage to eradicate polio from Pakur and from rest of India also. Good. Okay. So this is what worked. Enough resources. We had manpower brought from other states. 10 visiting SMOs in Pakur, 10 in Murshidabad, 6 in Sahibganj. And there was support from other agencies like UNICEF, Rotary, and there was support from people also. So this is what worked in this thing. We didn't know what to do, but it happened in such a short time. Between June and December, all this happened. But it really worked. Okay, for it. Now, this is a question which I'll ask you. This is a question which might come in exams. The number of cases of hepatitis A reported among children of a government school in a PHC area, where you are the only medical officer, there is 1 nurse and a pharmacist and a sweeper at the PHC. How will you manage the case? You are the only doctor, there is a pharmacist, there is a nurse and a sweeper. Okay. Next. So, solution, if you find out the solution, I'll solve it for it. This is another one which is a tricky thing. Number of rabies deaths in Kerala among school children, and all are vaccinated. What to do? Number of rabies deaths in children, all are vaccinated. What to do for it? So, check vaccines and vaccines potency. Check temperature at which vaccines are stored. So far, as far as my information goes, there is no such problem. Ensure culling, that is killing of stray dogs. Not possible due to court order. Ensure sterilization and neutralization of all stray dogs under ABC program. ABC is Animal Birth Control Program. Again, that is not possible. Last one is pre-exposure prophylaxis to all school kids. That means all school kids should be given 3 doses of vaccine, which is again costly and impractical. So basically, we don't have a solution for this. That solution has to be worked out. Okay. So this is one thing in which the government is still working how to do it. A lot of debates are all going on for it. Now this is another one of what we saw recently. Terror attack, knee-jerk reaction. A lot of people say, hit them immediately, do this, do that. Immediately attack neighbor. Ask the help of superpowers. Take the matter to UN. Impose sanctions. Cut the trade. So this is again an example. I took it maybe out of context, but this is what the various suggestions came. I know people who have told me, why can't we do this, why can't we do that, why can't we take POK, why can't we do this, etc., etc. for it. So what did they do? They assessed it. manpower, resources. They looked at the economic impact, they looked at psychological impact, they looked at the political impact. Okay. All this was taken. What finally happened? Waited for some time, set deadline for evacuation of Pak nationals, attacked only terrorist bases, in retaliation only attacked army and air force institutions. So this was what slightly delayed planning, but what actually happened. Okay. So this is just an example of which I thought in my mind to give you about planning. The initial knee-jerk response is if somebody hits you, hit him back immediately. So this, they waited for some time. This is what actually happened. Next. And then last 2-3 slides. Important thing is planning is for tomorrow, management is for today. Management is what you're doing today. You're the only medical officer in your PHC, RKONA. You have to do everything. You have to look at the patients, at the OP, you have to manage an epidemic, you have to do this, do that. Planning is, you plan for the future. Maybe you can write it to the district medical officer, sir, I cannot manage alone. He will say, okay, your situation is under consideration. Maybe next 2 months you will get somebody to help you. That is called planning. So planning is for tomorrow, management is for today. Okay. This is the last slide, which again, once again, a thing from WHO days, we used to quote it from somewhere else. If you plan to fail, if you fail to plan, you plan to fail. Okay. Very idiomatic sort of thing. If you fail to plan, you plan to fail. Simple. Okay. Now this is for your MBBS exams also you can use this. If you fail to plan how to pass your exams, you have 3 subjects, then obviously you plan to fail. Okay. So that is something. And again, this is another thing which each subject is important. Not that this subject is bad or this subject is good or this subject is easy. Every subject is important. So I'll just give an example regarding this. When you go to third year, you have only 2 subjects, community medicine and forensic. Community medicine has 2 papers, forensic is only 1 paper. So theoretically, which is easier? Theoretically, which is easier? You have 2 papers in community medicine, 1 paper in forensic. Which is easier? Which should be easier? Huh? Forensic should be easier, right? You have only 1 paper. Community medicine, you have 2 papers. But the result shows just opposite. More people fail in forensic than community. So don't take any subject lightly. That's my what I want to say for it. So these are some questions which are asked in the university exam. There's an outbreak of measles in a village. How will you investigate the case? Based on what we talked about just now. Second one is the number of students in the college had diarrhea in the morning. Many of them had food at a wedding reception. How will you investigate the outbreak and control the situation? Then third question is the number of cases resembling dengue have been reported from your area. What measures will you take? Okay. Then again, monitoring and surveillance are not the same. Explain. Feedback is essential in planning. Justify. Prioritization is an important step in health planning. Okay. Another question which I don't think I put here is monitoring and evaluation not the same. Okay. So these are questions which are asked in the university exams based on what the class is. So basically, you must have got some idea of. Yeah. So picture Pratham Dike. So Pratham Dike should go. So you got an idea of the planning cycle, what it is, and how it is done. This is the thing which you have to remember: planning cycle, situation analysis, determining priorities, developing aims and objectives, resource assessment, write-up, implementation, monitoring, and evaluation. So this gives a basic idea about how you can tackle anything, and whether it's your exams, whether it's in your field, when you're a medical officer in the field, an outbreak of measles, an outbreak of diarrhea, something more severe, more important, that is there. So you keep jumping around like without knowing where to go. You assess the situation. How many people have got respiratory tract infection? there may be 1,000 people, but how many are dying? Maybe only 3 or 4 are dying. It's not that much important. No, it's not. But you have 100 people suffering with respiratory tract infection. 20 of them are admitted to ICU. That's a calls for action. It's maybe corona, maybe something else. That is again determining priorities, then developing an aims and objective. What do you intend to do at the end of the day? Do you intend to make everybody healthy? And the aim should be it should be a smart objective. You can't say like when we were small, we heard Garibi Hatao. 40 years back, we heard Garibi Hatao. Those definitions of Garibi was different, but Garibi is now increased. Increase means the Garibi scale is also increased, but the specific objective. You cannot make a general thing that everybody is there. Maybe you can say that give a smartphone to everybody. Yes, it's possible. It's not that it's impossible, but you should know how to use it also. So, develop aims and objectives which are feasible. Resource allocation assessment. What all resources do you have? Do you have manpower? Do you have the money? Do you have personnel? Then write up what exactly are you going to do? Who's going to do what? What is the medical officer going to do? What is the nurse going to do? What is the pharmacist going to do? What are the other workers going to do? And so on. Then implementation. How are you going to implement it? Has it been implemented? If you keep on take a long time for implementing, it's of no use. All these are emergency situations. Epidemic of diarrhea, epidemic of few cases of measles. Those are all things which need immediate intervention. You can't drag it say for 1, 2 months, 3 months and all. Those needs immediate solution. Then monitoring. During the activity, you are going to see how it is there. Okay, like for example, See, each of us are given a small area, maybe from here to Muluk, or maybe from here to Arati Mode. That area also, each of us was given a small area, and that's where we focused on. That was the area where the cases were there. So, we prioritized and each one was given a thing. You check so many houses, so many things. Each of these 10 or 11 people who came from outside, including me. Okay. So, so then you implement monitoring and evaluation of this, and then finally recommending steps. So that is all regarding the evaluation and assessment. That is the end of the planning cycle. So I hope you have got an idea of the planning cycle and also the questions which are likely to come. Last slide then. Shesh slide. Shesh. Last slide. Shesh slide. Yeah. So the porita. Next. Yeah. So porita. So these are the questions, like possible questions which come for the university exams. Outbreak of measles, outbreak of diarrhea, outbreak of some respiratory tract infection. What will you do? How will you do about it? So first is situation analysis. You see the cases, verify it. It should not be based on press reports. Somebody has to go and actually visit the place and see it. Then make a list of priorities. Then assess what all resources you have, how much manpower you have medicines for it, etc. Then how will you go about it? You set up an objectives. Then you formulate a plan, implement the plan, monitor it, and evaluate it. Okay, so these are the common questions that are asked for it. And these are the short questions. Monitoring and surveillance are not the same. Feedback is essential step in planning, justify. Prioritization is important step in health planning, justify. And another question which I missed was monitoring and evaluation not the same. Okay, so I hope you'll be able to answer this question. Everybody can answer this question. Suppose the question comes on monitoring. I mean, this principles and management of yes or no? Kichu bolo? You understood? Last bench? Second last bench? I hope it's clear now. So, this is just to make things streamlined. We cannot One medical officer, two medical officers, three medical officers can't run around all the place. You have to, in a certain time framework, you have to do a thing. So, okay, so that's all for now. Thank you.